What kind of student were you in medicine? Were you?
I wasn't at the top of the class at any stage. I had good marks, and then I worked hard in school, and I was particularly interested in surgical subjects.
Why the interest in surgery?
I'm not sure. I think that as a boy, I had heard of Dr. Galley, because he and Dr. Lemessurier, both from Toronto, came to Stratford to look at crippled children. Because the year that I was born, in 1924, Dr. David Smith was one of the founders of the Ontario Society for Crippled Children. A terrible term, which we no longer use, of course, about crippled children, but I was influenced by these people. I could see the difference they made in the lives of these young people. So I was always interested more in surgery than in internal medicine.
And did you recognize a special skill with your hands from an early age? Were you artistic?
Well, I could draw. I could certainly draw things. I had a little book of drawings that I did, mostly from cartoon pages and that sort of thing. Subsequently became interested in oil painting. But I was always quite dexterous with my hands, making little model ships and model aircraft and so on when I was young. And when I did start getting into an operating room, I found it very natural and very easy to do the technical side of surgery, and I operated fairly quickly and with a good deal of certainty, and not just sort of fooling around with it. I really was a direct surgeon, and therefore didn't take very long to do most procedures.
And as a student, you'd flourished in dissection and anatomy?
Yes, I found that very easy and very exciting.
Right. And so what were your thoughts as you approached graduation? What kind of career did you hope to have?
Well, I had hoped to be a medical missionary. I had decided a long time ago that I should go to a third world country and be a surgeon, not necessarily trying to change people's religion, but to look after their physical needs. And I was very frustrated when I was a junior intern the year after graduation, because my application had been turned down both India and China. They didn't want any more white people. They wanted their own people, which is understandable. And so I was kind of frustrated, and I thought, well, maybe I'll become a general surgeon in Stratford or someplace like that. But things that were to happen in the future changed all that.